morning, Dr. Palermo with this week's Motivational Monday. As you know, we've been focusing a lot on gut health. Today I want to talk specifically about inflammatory bowel disease. Many people don't realize that over 1.6 million Americans struggle with inflammatory bowel disease. Of this 1.6, 80,000 are children. Every year we get 70,000 new diagnoses. Here's kind of a scary thought. U.S. only makes up 6% of the world population, yet we account for 25% of the inflammatory bowel cases. The problem is these inflammatory bowel cases are associated with other comorbidities like diabetes and heart disease and colon cancers and GI cancers and even Alzheimer's. There's a 2 times greater risk of Alzheimer's in people with inflammatory bowel disease. So when we look at inflammatory bowel disease, we're talking about things like Crohn's disease, ulcerative colitis. And recently we have found that even microscopic colitis may increase the risk for inflammatory bowel disease. So it's almost like a precursor. This is both lymphocytic and collagenous microscopic colitis, which may diagnose inflammatory bowel disease up to 20 years before it presents. So why are we struggling with so much more inflammatory bowel disease? Well, if you've been listening to our Motivational Mondays and informational meetings and topics, you know that it's our diet and our lifestyle that really increases our risk. The sad American diet, the standard American diet, which is loaded with sugar and preservatives, and the environment that we live in that is associated with heavy metals, BPA, appear to be associated. While there is a genetic risk, about 1 in 4 people carry that genetic risk. However, our genes haven't changed that much, but the number of cases have. As always, it's our diet that really does come down to it. Many of the studies looking at treating inflammatory bowel disease and studies that have helped individuals get into remission look at that diet, an anti-inflammatory diet, as well as multi-species probiotics, and even more specific anti-inflammatory agents like saffron and flaxseed, which have really reduced the incidence of inflammatory bowel in people who have already been diagnosed. But again, prevention is key, and trying to keep your diet clean and never go down that path is probably the best thing. So that's all for now. Have a great week.